on 680 CJOB. Raywat, appreciate you joining us. And while there are fewer in hospital with COVID, it's certainly not foremost in our minds, but events and these new variants, BA4 and 5, are kind of putting it back in the news, as they say. How much should we be paying attention to these variants and to COVID now and in the days and weeks ahead?
It depends on who we are. If we as public health, we should be paying attention to it a lot. If we as government, absolutely. The average citizen, it should be in the back of our minds, but shouldn't dominate our discourse. The issue here is that the vaccines have really taken the brunt off of hospitalization and death rates, which is fantastic news. But our health system is still in disarray because lots of people are still getting sick, including healthcare workers, and there aren't enough healthcare workers because they're all quitting. And so the ability of the healthcare system to support society is crumbling. And as you say, B4 and B5 are now hitting the streets pretty hard, and they have a higher probability of creating breakthrough infections. So we're looking down the barrel of a seventh wave at the moment, and hopefully we will take appropriate steps to blunt that probability.
All right. What are those appropriate steps?
I think we have to look at third and fourth doses. If you're eligible for a third and fourth dose and haven't gotten one, you should. We should be making fourth doses available to everybody over 18 if we have sufficient supply. And we do have sufficient supply. And the reason for that is that fourth dose, the evidence is pretty clear, really does improve the ability of the vaccines to keep you out of the hospital and out of the morgue, but also to prevent actual infection at all. It doubles your chances of preventing actual infection. We need that right now. And yes, this will wane eventually, but it buys us a few more months of population immunity, and that will curtail the seventh wave.
With us is Raywat Deonandan from the University of Ottawa. He's a PhD and an epidemiologist. So you're a doctor, not that kind of doctor, but when you're doing your research, what are you seeing about these variants, particularly in other countries?
It's BA4 and BA5 is supplanting B1 and B2 in some countries, and here as well, particularly in the USA. It is worrying because we thought back in last fall, I was saying that Delta is the most contagious respiratory virus we'd ever seen. Then Omicron came and blew Delta out of the water. And then B1 and B2 came and blew Omicron out of the water. And now B4 and B5 are making Omicron look slow. So increasingly, this is a more contagious disease, which means that more people are going to get it. We're also seeing that the effects of multiple reinfections are not good. It actually might be increasing your probability of hospitalization and death. So it is worthwhile avoiding infection altogether. Do not seek infection. Do not consider infection to be a casual thing. And we avoid infection by, again, vaccination, by wearing a mask in outdoor public spaces, at least for a while, and by investing in engineering solutions that can improve ventilation.
Back in the olden days of Delta, we saw that people getting infected maybe had that extra layer of protection with that natural immunity, hopefully on top of a vaccine as well. Are you saying now that we may even have a greater chance of getting reinfected, even though these different variants?
Omicron as a natural booster does not seem to be as potent as Delta as a natural booster. So natural immunity acquired through Omicron infection does not appear to be a thing. The rate of reinfection is quite high. And again, some new evidence suggests that with each additional infection, you're not improving your immune profile. You may be degrading it, actually. And again, this is controversial data. It may end up being incorrect, but that's what is being observed at the moment. So we have to avoid infection. Now, getting that same immune profile through vaccination does not pose the same risk for a number of reasons, which is why I advocate for repeated vaccination. Vax yourself to the max until we get a second generation vaccine, which offers longer and better protection. And they're coming. Scientists are working on these second generation vaccines, which will really curtail transmission better. So science will get us out of this. Be patient. But in the meantime, we have work to do as individuals, which is, again, to avoid infection in our own lives.
I'm thinking about a friend who lost her mother a year ago today one of the transfers from Manitoba to a hospital where you are joining us in Ottawa, and grim reminders of what has been behind us, but certainly what could come back. And while you tell us about getting those boosters again, I think there's a lot of people that haven't had that second booster or that fourth shot that should be getting it. I'm wondering why you think that is so, that people just don't want to get those extra boosters.
A number of reasons. Number one is this narrative that the pandemic is over. It's not over. Number two, this narrative that 2 doses is fully vaccinated. It's not. 3 doses is probably closer to being fully vaccinated. And this sense that there's additional risk posed by being boosted. There isn't. The data suggests that there is no increased safety profile with additional boosters. So this is a failure of communication and of public education more than anything else. I think if people understood just how much additional protection that 4th dose offers with minuscule, if any, additional risk, that they would opt for that 4th dose. It's up to our leaders to make the doses available and to make the information available so we understood it better. But the New York data shows that 3 doses reduces your risk of dying by 86% if you're over 60. 4 doses reduces that risk by 99%. I would much rather have a 99% reduction in death risk than 86%. And I think most people would agree with me. And the Israeli data shows, again, that the improvement is doubling or quadrupling in some cases, depending upon if you're looking at infection, symptomatic disease, hospitalization, or death. So the data is clear. And I think we haven't done a good job at expressing that data or at expressing the fact that the crisis, while much less than it was 2 years ago, is still with us.
Raywat Deonandan, always good to check in with you. Thanks so very much for joining us.
Thank you.